बघता बघता 30 वर्ष गेली असं वाटतं. हे सगळे वर खाली चढ उतार खूप होते, पण त्या मानाने 30 वर्ष फार
लवकर गेली.
लवकर.
आठवत आहे ना ते आपण रिक्षेतनं
रिक्षेतनं आपण रजिस्ट्रेशनला
गेलो
गेलो
होतो
होतो.
आणि तिथनं आता 30 वर्षानंतर
इथे पोचलो आहोत.
20 जुलै 1994.
94.
In 1994, Prayas was registered as a trust to work in 3 areas: health, energy, and learning and parenthood.
We were all friends, young, but full of ideas and a lot of enthusiasm to do something, to make a difference in society.
इफेक्टिव्हली त्यातल्या भावना अशा होत्या की आता एकत्र काम करायचं आहे, लॉंग टर्म काम करायचं आहे आणि पुरे प्रयास के साथ करना है.
त्यावेळेला असं वाटलं की आपल्याला जे करायचं आहे ते प्रयत्न आहेत, पण आपण खूप मनापासून खूप जीव टाकून हे प्रयत्न करू. त्याच्यातनं प्रयास हेच नाव आलं.
त्या अर्थाने बघायला गेलं तर आपली वाढ खूप रॅपिडली झालेली आहे दोन्ही ग्रुप्सची. म्हणजे कमी अधिक वेगाने
प्रयासच्या स्टँडर्डने
प्रयासच्या स्टँडर्डने. हो.
And I think it has proved that even being in Pune, the quality of the work and the commitment, I think both have delivered that effect.
दोन्ही गटांची इच्छा आहे की इमर्जिंग चॅलेंजेस जे आहेत त्याच्यामध्ये काम करा, नवीन विचारांनी काम करा.
पण कंटेंट मला असं वाटतं दोन्ही हेल्थ ग्रुप आणि एनर्जी ग्रुप कंटेंट वॉज पायोनियरिंग. When we are starting on something new, which emerges from a passion, then we really don't know how it's going to end. In fact, that's not even on our minds. The destination doesn't really matter. We just want to get started on doing that thing. And the results can be very surprising. That, I think, essentially is the story of Prayas. We were all friends, including Girish, who unfortunately is no more with us. Lots of ideas and lots of enthusiasm to do things, to try and make a difference in society. It really didn't matter that our areas of interest were different, that our backgrounds were different, because we recognized that even as we did different things and we did things differently, we could be of support to each other.
Girish was from engineering background and he did specialization in energy systems. He was very concerned about poor state of services, energy services to large sections of society. He also strongly felt that we need to move towards clean energy resources, and at the same time we need to ensure that society uses energy in more judicious manner, in more energy efficient manner. I also felt that government policies and their implementation has significant impact on society, public finances and the way we deliver energy services to our communities.
When we started our clinic in 1985, HIV or AIDS had arrived in the world but had not yet reached India. But from my background in my postgraduate days, I had that feeling that HIV is going to be a problem in our country also, and we should do something about it. So we had started with some kind of awareness programs, but from 1989 actually, many patients started coming to our clinic. The care was denied because there was a lot of fear in the minds of the healthcare providers. There were hardly any people even touching them, and they were all discarded from the healthcare. And we felt that we should do something. And our clinic should be a place where everyone's dignity would be respected and a passionate as well as humane care would be provided, because there was no treatment. We knew that everyone who walked in was going to die soon. But at the same time, even that sick patient needed a support, and we started our counseling services. When treatment became available, we started providing care also. That's how the program for HIV started, and later on expanded into many other things.
It was the time when I was thinking a lot about parenting and education. I was experiencing that rearing children was a challenging task, and adults should try taking it seriously. I was realizing that there is very little material about parenting, especially in Marathi. And parenting is not just personal, it's a social responsibility. I took lead in taking out a Marathi monthly called Palak Niti, and this initiative eventually developed into another thriving organization.
When Subodh came in, that is Subodh Wagre, when he came into Prayas, he of course shared the interests that everyone else also had on energy issues. But he very strongly felt that we should also look at the developmental impacts of the entire development process. Criteria for that was how it would impact the livelihoods of the poor and vulnerable. Thus was born the RELI group of Prayas. RELI meaning Resources and Livelihood Group. Apart from livelihoods, the RELI group also looked at issues like natural resource management, rural development, people-centric governance of the water sector. Of course, these were very different issues. Prayas is an interesting amalgamation of very different streams and very different work themes. But all of that evolved organically. The central concern that connected all of these different themes was how can we use our professional abilities and our professional skills to further the greater public interest.
The discrimination about HIV was even worse at that time. There was hardly any knowledge available, and there were no medicines also. So first thing we started was doing the awareness programs, increasing the awareness in the society, as well as provide psychological support, psychosocial support to the patients walking into the clinic. So we started our counseling services. When medicines became available, we started making them available at a cheaper cost. Simultaneously, we were creating a lot of awareness material for prevention in the society, as well as for the physicians and doctors who were having little knowledge about treating the diseases. Main important issue in our clinic was that no one would be denied care and everyone would get a compassionate care irrespective of class, caste, religion, gender. So people started coming into our clinic, and that led to our initiatives in the research as well as in the advocacy.
Our PMTCT, that is Prevention of Mother to Child Transmission of HIV program, is a good example of our evolution of responses. We were deeply affected by the deaths of children seeking care in our clinic. In those days, I remember in 2002, we were invited to take part in a consortium to implement a program for prevention of mother-to-child transmission. It went on to become first and one of the largest private sector interventions in India.
It was very clear to us right from the beginning that if we want to save children from getting infected, we must address the issue of stigma and fear first. PMTCT services need to be integrated into overall obstetric care and not as separate HIV facility or HIV care. The biggest lesson for us at that time was, if you want a positive change to happen, then one must engage with the entire ecosystem, and it requires quite deeper and sustained engagement.
PMTCT ट्रीटमेंट मिळाल्यामुळे अनेक मुलांना इन्फेक्शन टाळण्यासाठी मदत झाली. असं असलं तरीसुद्धा औषधं न मिळाल्यामुळे अनेक मुलांना इन्फेक्शन झालं. पुढच्या काळामध्ये जेव्हा HIV ट्रीटमेंट उपलब्ध झाली त्यावेळेला मुलांचं सर्वायवल, आयुष्यमान हे चांगलंच वाढलं. ही पहिली पिढी होती जी HIV सह तारुण्यामध्ये प्रवेश करणारी पिढी होती. सो यांचे तारुण्यासह असणारे प्रश्न जे होते तेही खूप वेगळ्या प्रकारचे होते. यांना असणारे प्रश्न आम्हाला दिसत होतं की आम्ही जगू किंवा नाही, आम्हाला मुलं होतील किंवा नाही, ट्रीटमेंट मुलांची कशी असेल, लग्न होईल का, डिस्क्रिमिनेशनशी डील कसं करायचं, आणि त्याच्याचबरोबर मेंटल हेल्थ इश्यूजही या मुलांच्यामध्ये आम्हाला दिसत होते. सो या सगळ्या इश्यूजला डील करण्यासाठी आम्ही एक प्रोग्राम तयार केला ज्याचं नाव होतं HIV सह तारुण्यभान. HIV सह तारुण्यभान कार्यक्रमांमध्ये जी मुलं सहभागी झाली त्यांनीच पुढे जाऊन एक ग्रुप तयार केला, सपोर्ट ग्रुप, ज्याचं नाव होतं सो वॉट. सो वॉट वी आर लिव्हिंग विथ HIV. सो वॉट हा ग्रुप आता पुण्यापुरता सीमित न राहता महाराष्ट्रभर या गटाचं नेटवर्क पसरलेलं आहे.
Energy Group's work is in different areas but has very similar approach. For example, 1990s Enron project really highlighted if projects are not done in a transparent manner, if there is no accountability, then such projects can have huge negative effect on public finances as well as consumer tariff. An analysis and critique of this project gave us the confidence that committed analysis can have strong impact in terms of improving public policy. But at the same time, it also taught us that it's not enough to just work on one or two isolated projects. One needs to really look at policy in a comprehensive manner and work on many other issues such as agriculture electricity consumption or consumer tariffs. This led us for strong and consistent engagement with regulatory commissions which were established in the late 1990s across multiple states. And we started engaging strongly and extensively with Maharashtra Electricity Regulatory Commission on many issues relating to the electricity sector.
Our work and engagement very soon spread beyond Maharashtra to other states and to the national level. In electricity sector, the central government and the state governments have independent, separate roles. So understanding this, and we were able to analyze sector issues based on grounded analysis and engage with the sector at state and national levels. Some examples include improving the quantity and quality of participation in public hearing, improving the estimation of agricultural consumption, introducing competitive bidding in generation projects, and improving the implementation of rural electrification programs. So we worked with many state consumer groups in many states by conducting sharing workshops, developing guides, and the first ever economic primer in electricity sector.
These initial years all-round approach using strong analysis, consistent engagement with policy and regulatory processes, and organic connect with consumer groups forms the foundation of Energy Group's work in the sector. Our team expanded. We started working on many other issues relating to the energy sector, but this work is rooted in these early experiences and opportunities and learnings.
Health Group steadily expanded the work beyond the domain of HIV by focusing on newer ideas, emerging issues. We expanded the work to sexual and reproductive health, to cancers affecting women like cervical cancer, breast cancer, and more recently the work on how climate change impacts health.
I think our responses have been typically four-pronged. First, provision of clinical and counseling services, then increasing awareness, conducting research, and implementing public health interventions. And it has helped us, this approach has helped us in many ways. We could understand community needs better. We could pilot out some innovative ideas at a smaller scale, use these insights for creating better programs, and then advocate for policy change.
Actually, a good example of this, how this approach helps each other, is our work on sexual and reproductive health, where clinical services, research programs strengthen each other. For example, when young people were coming to clinic and seeking more care for sexually transmitted infection, we asked ourselves, do we really know their vulnerabilities? Do we really know what are their decision-making processes? This question led us to formulate Youth in Transition research, which gave us immense data on sexual behaviors, vulnerabilities, mental health concerns of young people. But more importantly, it also highlighted one of the important critical gaps, that is lack of spaces for young people to talk about their concerns, particularly unmarried young adults. And therefore we designed a program called Nest for Youth, which is a counseling space for young people, a non-judgmental, empowering space. As we started working more on this issue, we realized we really need to start very young to build agency and capacity of young people, which led us to formulate a program called Sahaj, Sanman Hakka Jawabdari, a 80-session program from 1st grade to 10th grade to deliver comprehensive sexuality education in school.
The current discourse on climate change is mostly focused on mitigation, which is reducing carbon emissions. But we must also pay attention to the impacts climate change is causing or it may cause in future. And this includes health impacts as well. In fact, climate change is considered as biggest public health challenge of this century. Unfortunately, this aspect has received minimal attention so far. There are more questions than answers. For example, how do we adapt to the changing situation? How do we increase the resilience of our health system so that health impacts are minimal? We have started exploring this issue. We are trying to see what are the health impacts specific to the Indian context. We are also trying to explore what is the role of community participation and community engagement in health adaptation.
Women living with HIV are disproportionately affected by cervical cancer as compared to women in the general population. Cervical cancer screening and management of pre-cancer is a standard of care at our clinic for women living with HIV. We started our work in this area initially in 2010 for a research study, and we enrolled one of the largest cohorts of women living with HIV. We published extensively in this field as well. Subsequently, we started our community outreach program considering the need for screening women in the general population for cervical cancer. We have a mobile screening unit which goes to different communities, and we screen about 3,000 to 4,000 women per year. Our colposcopy clinic at Prayas is also recognized for the national as well as international colposcopy training courses.
What really matters is that everybody gets reliable supply at affordable or competitive rates. And it's with this in mind that we look at the electricity sector across the value chain. So we look at issues of generation, fuel supply, renewable energy, transmission, distribution. And we're looking at this at the central and the state level. And the aspects that we look at are planning, policy, regulation, market reform, etc. And the idea is to really help distribution companies prepare for the energy transition before them.
Right, and building on that, our work across multiple states and at the central level has helped shape better policies and regulations, develop new and innovative context-appropriate solutions for India's energy problems while enhancing transparency in the power sector. One such policy innovation is the idea of setting up solar power plants near substations dedicated to agriculture. And this is being implemented at scale in Maharashtra and in many other states.
On the demand front, data related to how electricity is being used, by whom and when is currently not available to the detail that is necessary to have more efficient network planning as well as to plan for supply efficiently. At Prayas, we have been focusing on trying to gather data from on ground and understand electricity consumption and usage patterns better. We have also been trying to do this not just at the state or city level but also at the national level. What this does is helps us understand energy consumption better and also then help in the planning processes. We also believe that technology is very useful to build data about consumption, and smart metering is one of these technologies which will help in understanding electricity consumption better.
Yeah. So we would all agree that a rupee saved is much more worth than a rupee earned, and that's where energy efficiency comes in. So even in energy, a better use of energy is as important as, if not more, than having a cost-effective source of generation. So our work has focused on how do people buy more efficient ceiling fans, refrigerators, air conditioners at their homes, as well as different technologies in industry, so that we can save energy, reduce our electricity bills, reduce the strain on the power systems, and also have benefits on environment.
Energy and power systems are getting increasingly complex, and the old ways of planning for these systems using thumb rules is no longer going to work in future. What you need are sophisticated computer-based models that will help you do these things better. To help with this, at Prayas, we've built two models, both of which are open source. One is GridPath, which is a power systems model to help you plan and manage power systems. The other is Rumi, and on top of which Peer is built, which helps you do energy systems modeling and in particular bottom-up demand estimation across sectors.
With GridPath, we are building various state-level power sector models to inform resource planning exercises that are relevant for those states. With Peer, which is based on Rumi, using the demand that is estimated, we are identifying supply options over the next couple of decades, which then can help inform development and climate policy for India. In all of these exercises, we are doing a lot of collaborative work with other organizations, such as state-level practitioners like DISCOMs and load dispatch centers, as well as other research organizations.
So we share our research with multiple actors in the sector, whether it is state or national level policy and decision makers, or regulatory commissions, or government agencies, or unions, or consumer groups. And our research could be, as reports, which are all available in the public domain on our website. We also have webinars where we share some of the research that we have, lots of portals, and we also have a primer for citizens to understand the electricity sector a little better, and many guides for consumers also to engage with the electricity sector.
We have used variety of audio-visual formats to share vital health information with our audience. Our focus has always been making these health information more entertaining, more engaging, and to achieve this, we have used variety of formats such as storytelling, web series, 2 to 3 minutes animated videos, plays, just to ensure that it reaches masses and it connects effectively.
To accommodate the capabilities and the constraints of our different group members, we do have a collective and a flexible management style. We do share a lot of our achievements and interests with each other, and we always look for the opportunities basically to celebrate all our achievements. And this helps to bring the best of all of us, and also basically it creates a strong bonding with all of us.
In these 30 years, many well-wishers and supporters helped Prayas openly with their insights, resources and guidance. We learned a lot from many people's movements, consumer groups about ground level realities and the challenges that people on ground were facing. We benefited from many public spirited individuals. We benefited because of the trust and confidence reposed by many regulatory commissions, government officials, ministries. This journey wouldn't have been possible without support of any of these individuals, well-wishers and organizations.
For health group, it has been all our patients, and we have learnt a lot from them. Our work would not have been possible without their faith in us. But all of these are kind of in front of us, but there is a team which is behind, and that is our board of trustees. In last 30 years, we have had a very nice team which was critical as well as very supportive to us. Anand Phadke, Medha Kotwal and Subodh Wagre are our trustees, apart from myself, Shantanu and Sanjeevani. I will also mention two names, Dr. Sanjay Mehindale and Sadhana Dadich, who were our previous trustees, and I wholeheartedly thank them for supporting us through these 30 years.
Prayas Energy Group is now 40 members strong, and good thing is most of these members are under 40. So a strong commitment of this team, passion for contributing positively to the sector, along with strong trust of sector actors is what keeps us motivating to do better and better in the sector.
When an organization reaches 30 years, there would always be challenges. Everything is not very smooth, and both energy sector as well as the health sector have had their issues and challenges which were old as well as new. But of course, with the young team and the new team, with profound analysis, then building the consensus and working with the people with whom we actually work is going to take us forward. And I am confident that after these 30 years, which have been very fruitful, we would still keep on doing our good work.
For me, Prayas is inclusive and progressive. I like working at Prayas because I get to contribute in making a difference and creating awareness about topics that are taboo and need to be talked about more.
प्रयास म्हणजे माझ्यासाठी एक सेल्फ कॉन्फिडन्स. हे आल्यापासून माझी पर्सनल आणि प्रोफेशनल डेव्हलपमेंट झाली आहे.
फॉर मी प्रयास इज मोर अबाउट व्हॅल्यूज अँड प्रिन्सिपल्स.
प्रयास म्हणजे माझ्या आयुष्यातली सपोर्ट सिस्टीम.
हे एक कल्चर आहे. इथे भेटलेली सगळी माणसं माझ्या जीवाच्या खूप जवळची आहेत.
To me, Prayas is the manifestation of the phrase, policy is the art of the possible.
Prayas represents an endeavor towards critical thinking, infused with a spirit of hope and perseverance.
प्रयास संस्थेला तिथे काम करणाऱ्या लोकांना समाजासाठी निस्पृहपणे अविरत झटताना बघितलं की माझाही समाजातल्या चांगुलपणावरचा विश्वास बळकट होतो.
Prayas makes an impact, directly or indirectly.
Prayas is a ray of hope for me.
For me, Prayas is collaborative.
प्रयास माझ्यासाठी कुटुंब आहे. सन्मान, हक्क, जबाबदारी देणारी संस्था म्हणजे प्रयास.
I consider Prayas to be one of the most important milestone of my life.
I work with so much talented people and they are understanding and kind at the same time.
Prayas culture is so much more open, collaborative, democratic and enjoyable.
Prayas is a place where I feel content with my work.